Hello, PeDRA listeners and viewers. I am so excited to be at the 8th Annual Symposium on Hidradenitis Suppurativa Advances, and I am even more delighted to be joined today by Jasmine Espy, founder and CEO of the Association of Hidradenitis Suppurativa and Inflammatory Diseases. Thank you so much for joining me, Jasmine.
Thank you so much.
So you are the founder and CEO of this organization.
Yes.
Tell me how it came about and why it's important.
I love telling this story because it started from actually my background in journalism. So I'm a broadcast journalism by trade. And I actually got my BA in journalism, and then I got my master's degree in journalism as well at USC. And so interesting enough, for my master's thesis for school, I created a documentary on HS from a Black woman's perspective. And so that was the catalyst to everything that I'm doing now, is really doing that documentary and really telling my story and other Black women's stories in the community. And so after that kind of took off, we had a premiere at Sony, we had a premiere in Detroit, Michigan. And then of course, February, I moved back to Los Angeles, found an apartment, and the next month the pandemic hit. That was into 2020, okay? And so we had to readjust at that point. And at that time, I was not a 501c3. I was under a different name. And at that time, I really wanted to figure out a way to impact the HS community. I saw a lot of educational opportunities for physicians, but there was a lack of educational opportunities for HS patients and caregivers. And so that's when I really kind of sat with myself. I kind of looked at what the community had already. And I said, something that I think could add to this space is a summit for all of us to get together and to learn more about HS, education, research, treatment, wound care, everything, even holistic care, because a lot of patients, a lot of people in the community were relying on holistic medicine where, some modern medicine was failing or they didn't have access, things of that nature. And so we started that in 2020, and that was a virtual conference, of course, because everything was behind a computer screen for a few years. And so we're actually going into, I believe it's our 5th year. And next year it's actually going to be a hybrid virtual and in-person summit. And so that's kind of how we got our start. And we were under the name My Gold Lining before, but we wanted to realign with the communities that we're serving because, when you say My Gold Lining, that doesn't indicate who we're serving. It almost sounds like a production company, And so that's kind of what it was. But I was just like, this has evolved into something else. And so by, funding from, UCB, we were able to really change and rebrand and really strengthen the work that we were already doing in the community at the beginning of this year. So that's where AHSID came about, and we got a website, we got our branding, we got all of our educational materials, and we're here at SHSA again, but under a new name.
I love that. So much of your story is so inspiring. And you talk about wanting to educate patients. So What does that look like? Tell me more about that.
Absolutely. So education really looks like providing resources, credible resources, vetted resources from not only myself and my network, but from other patient advocacy groups and other individuals who are trying to impact the community. So that's pharmaceutical companies who want to come in and really connect with patients, but not only pharmaceutical companies, but other small businesses, estheticians. It expands really across the board. And my organization isn't just about HS patients; it's also about the communities that fall under the comorbidities that are also associated with HS. That's the inflammatory disease part of it. And so we are really focused on providing those educational resources. So we have the HS Basics booklet that we created. We revamp it every year. It has everything from patient advocacy organizations, influencers, to treatment, wound care, advances in research, things of that nature. And then we also have a pamphlet, and we're creating more programming to expand the work and expand our reach and really target marginalized communities within the HS community. So yeah, those are some of the resources that we offer so far.
I love that. And I
Thank
love
you.
that your organization is so collaborative. You talk about, yes, you're here for the patients and educating them,
Yeah.
but you're also in close connection with pharma and your
Yeah.
relationship with UCB. And then here you are at this scientific meeting.
Yeah.
So you're really spanning all those areas that come together to make an impact for patients.
Absolutely, yeah. And, you know, one of our mottos, or the thing that I live by, is providing people affected with HS or living with HS and associated comorbidities options. So I feel like sometimes we have the illusion of choice. So it's like, do you want coffee or tea? But it's really, there's coffee, there's tea, there's juice. You know, some people might want to have a beer in the morning. I don't know. But, it's about having all the resources that you possibly can and then making a choice after that. You know what I mean? So if you don't know that you can have access to biologics, you're not going to use them. If you don't know that there's zinc that you can take to also help to keep your symptoms at bay, you're not going to take that. So that's where our organization comes in, is really providing that holistic look at HS, not just the science and the medicine, but really focusing on mind, body, and soul. Yeah.
And there's such a big need for that, because with HS and the comorbidities that go along with it, it's so, we hear it takes 10 years for a diagnosis to come in many cases.
Mm-hmm.
So approaching it from that holistic viewpoint must really provide a lot of comfort and hope to the patients that you work with.
Yeah, and it's really from paying attention to the community and what they're saying and what they're doing. I think sometimes, if you don't have an ear to the ground, you might say, okay, this is what the community needs. And it's like, okay, well, did you ask? Did you ask the community? And, me being a patient is only a step in the right direction. It's not the full, walk. You know what I mean? So if you want to take the full walk down the path, you have to actually talk to people beyond the circle that you have, beyond your own basic knowledge as a patient. And so that's exactly what I did, was reaching out to the community and really hearing people's stories, talking to them about, what are you lacking? What has been your experience? Has it been good? Has it been bad? What have your resources been, And so I really saw that some people were using the holistic approach, and then some people lean more towards, modern medicine or the other way, but the spectrum is just so vast.
So before we sat down and started rolling, we talked about how difficult access can be and how challenging it can be to get a diagnosis, and how once a diagnosis comes, it can be even more challenging to navigate insurance and get approvals. Can you speak to your experience with access and getting coverage?
I had a full-time job in 2022. And with that job, I had PPO insurance. And so, unfortunately, in California, the physicians that I was trying to see, or I was seeing beforehand, only took PPO. So when I had to get state insurance, for an example, I couldn't see those physicians anymore. And so I went a very long time without seeing a physician for my HS, and there were some concerns that I had, And so, unfortunately, I had to do things on my own. But now, thanks to my project manager, Glorielle, I got connected to Tono Health, actually, with Dr. Gies in Bryson, who is the CEO. And Dr. Gies is one of the physicians that works with Tono Health. And so I get to see her. And she's been instrumental in helping me move forward and pick up basically where I left off with Dr. Hamzavi, who was my dermatologist for a decade. So, yes, and still, I would consider us friends now. So, yeah.
Well, especially now that you are at the helm of this organization and you're
Exactly.
attending meetings like this, it's a completely, it's the other side of that same coin, right?
Absolutely. Yeah, it's completely different. And I honestly did not think that I would get to this point, just because I feel like being a nonprofit founder is it's an interesting leadership role that I didn't really see myself in. But it's like, there's a need in the community. I have ideas, and there are individuals that are interested. There's community people who want to come and help and support. And so it's just like, I can't not lean into this work. It's almost like it's calling for me, And it's calling for a lot of us. And that's why you're here. That's why I'm here. That's why we're all here.
Yeah.
You know what I mean? It's because we're getting that calling as well.
Yeah.
So it's a beautiful experience to be around all of that energy, you know?
It really is.
Yeah.
And just to wrap up here, what does the next 5 years look like for your organization and making an impact in HS and those inflammatory comorbidities?
I love this question because it's exciting for me. We mapped out actually a 10-year plan.
I love it.
But we'll give you the 5 years.
You are a woman with vision, I know.
Okay, I got so much vision. So the next 5 years for AHSID really looks like, strengthening our staff so that we can go out and do a lot of the work that we want to do. We want to do more in-person events, more pop-ups, more getting resources to underserved communities, really providing more educational opportunities for patients, teens, mothers who are, people who are pregnant. Also, when you're thinking about like homelessness populations and people who are at disadvantages, like getting them resources like our HS Basics booklet, like our brochure and things of that nature, and really strengthening those initiatives. And also getting involved with more pharmaceutical companies, more small businesses, more patient advocates. We're doing we have a lot of initiatives like finishing our documentary so that we can put that out, which is exciting. We're also doing an ambassador program, building our volunteer program out. We have so many things that are planned in the pipeline right now. Yeah. So I'm really excited.
So much wonderful things you're
Yes.
already doing for the community and
Yes.
the greater scientific community, and so much more to come.
Thank you.
Thank you so much for talking with me today, Jasmine.
Of
This
course.
has been a real delight. I'm so honored. Thank you.
Thank you so much for having me. I appreciate it.
To learn more about the Association of Hidradenitis Suppurativa and Inflammatory Diseases and the amazing work that Jasmine Espy and her colleagues are doing, please visit www.theahsid.org. Be sure to follow AHSID on Instagram, TikTok, Facebook, and YouTube at The AHSID. Thank you so much for joining us for this mini community spotlight.